I got into this work partly like most people, to fix their own body. So starting from the age of about 15, where I strained my back, for about 20 years my back would go out, and do the typical things and get Percocet and have to lay off doing anything for a few days. And after years of self-treating, I had a class in what's called core integration, whole body movement. And there was an instant in time, I remember to this day, where I became aware that I did not use my body in a way that allowed my back to relax. And once I learned that, I could relax my back. And it empowered me to create less tension during the day. So I had to take less tension out. And this is my passion around giving that awareness to other people. So that's one of the main things I do, is I show people that by changing how you use your body, you can take your own pain away without drugs, without anything else. And people are amazed how you come in with the pain and you can let go of the tension if it was a tension issue. And you could have no pain doing the same exact thing, but in a somewhat different way. In the initial consultation, you're going to tell me where it hurts. Right? I'll ask you on a scale of 1 to 10, is it a 5 of 10, is it an 8 of 10? And that'll be our baseline. And then I'm going to have you show me when it hurts, like when I'm sitting, when I'm standing. And then I'm going to check what that sore area is connected to, and could it be connected in a better way that allows that sore, painful area to relax. And then if this is relative not to a stationary position, but relative to an action, I'm going to ask you to do that action, and I'm going to see how your body moves. And frequently there'll be a good side and a bad side, and then it makes it easier because the good side already is integrated. And I'll show you that when you move the non-painful side, that it works entirely different than the other side. My long-range goals for my patients are simply to have them better take care of themselves, because taking care of yourself is a daily event. I don't like the idea of they break it, I fix it. That's very expensive. Right? So to make what I do the most valuable, I identify the problem. I find where in your activities that you start to create pain and dysfunction. And in educating you, you get to identify it and you get to change it. For example, I have a patient that's coming in who's a music teacher, and I know that when she puts her hands on the keyboard, she slowly, gradually lifts her shoulder off of her rib cage. So this person's going to have a lot of neck and shoulder problems. So the idea is to make sure that the person knows to relax or drop their elbow and only lift their hand. And then I have a lot of exercises to do just that. So even though I've been in this business for over 25 years and seen thousands and thousands of people, I still have the excitement of the challenge of figuring out how people can improve themselves. So I look forward to seeing you. If you're visiting this website, I would love to see you and see what we can do together to create the kind of life that you want.